Good evening, ladies and gentlemen. I am Sanchita from BM Birla Heart Hospital, CK Birla Hospitals, and today with us we have Dr. Rakesh Sarkar, electrophysiologist and cardiologist associated with BM Birla Heart Hospital. Dr. Rakesh Sarkar is an electrophysiologist and is associated with us for some time. And with his experience, with his immense amount of experience in education, he is an expert of arrhythmia, of electrophysiology, and treating particular diseases like atrial fibrillation, atrial flutter, ventricular tachycardia, and devices. So, welcome, sir. Today, as promised, we will be talking about arrhythmia and all about arrhythmia. So, to start with, sir, I want to ask you that what exactly do we understand by arrhythmia?
Right. So arrhythmia means something not in order with regards to the rhythm. So whenever we are talking about the rhythm, it is the rhythm of the heart. As we all know, that heart is a very important structure to sustain our viability and livelihood, because it keeps on like pumping for 24 into 7, and this thing is not possible unless and until there is some source of energy which constantly motivates or triggers some energy to pump the muscle of the heart. So basically what is happening, the heart, when it gets the electrical energy, uh, it is generated within the structure of the organ itself, and there is a defined and definite route, or you can say some electrical circuit through which the electrical energy actually gets conducted to the different chambers of the heart, because initially it generates in a particular point of a chamber, one of the chambers of the heart, as it has already everybody knows that it contains 4 chambers, and it generates predominantly from the right upper chamber, which is called right atrium, and from there it actually gets conducted, or you can say transmitted to various chambers. But there is a mechanism, defined mechanism to get transmitted, and if there is some abnormality in either conduction of this energy, like it can actually result in some diminished frequency of generating the current, or any disruption of the propagation of the current can result into sometimes low heart rate, which actually we call in medical lingo bradycardia, or less heart rate related arrhythmia. And sometimes there may be some excessive current within the heart muscle or the chambers, which can trigger some other symptoms, which is also essential to treat the patients. I mean, it's a significant amount of patient who can potentially have these symptoms because of different problem in the circuit itself. So predominantly this is called tachycardia, or arrhythmia related to excessive heart rate. So this is basic of arrhythmia, or you can say essentially cardiac arrhythmia.
So, in a gist, what I understand in layman's language, so if the heartbeat is not proper, so if the heart is not beating as it should be, if it is faster or it's slow,
Yes.
then we can call it as arrhythmia.
Right. So what happens whenever we talk about the beating with regards to the rate? I mean, whether it is slow or fast, not necessarily all the time it should be arrhythmia. Like in a normal patient, or person rather, I should say, in a given context, the heart rate can go very fast whenever a person is walking or running or doing some exercise. At the same time, sometimes in an athlete or a person who is a kind of gym person, sometimes at rest, or even in a normal person at the time of sleep, the heart rate can actually go down in a very alarming way. Like what we presume that normal heart rate is 60 to 100, but sometimes it can go even up to 40 or 35. You can be astonished to hear that some celebrity athlete always has some tendency to have the baseline heart rate of 35 or 36, but essentially these are not arrhythmia. Okay, so when we are talking about arrhythmia, we are talking about the rhythm, means there is either any disruption of the rhythm which is not supposed to happen in that particular given context, and predominantly it is associated either with some increased rate or decreased rate, but it is not mandatory to have arrhythmia all the time whenever it goes down or fast. So rhythm means something not in order, means there is a fashion to beating, I mean beating of the different chambers, like upper chambers beat first followed by the lower chamber. So if that is so, there should be some coordination between upper chamber and lower chamber. And if you can see that either the upper chamber and the lower chamber is not beating in a coordinated or coherent way, or there is some mismatch, or like upper chamber is beating significant at higher rate, or even the rhythm, means the pacing or the electrical impulse generation is not in very regular fashion. So that is very important. So what I can explain at this point without going in details into the electrophysiological stuff. So this is important not only with relation to your rate, it is important to understand the rhythm, like how the different chambers are beating with respect to their frequency as well as their sequence.
Okay. So, coming to the uh, arrhythmia. So, now since you have explained what exactly it is, I wanted to understand, sir, why does it happen?
Yes. So as I told or briefly said before, you question that pertinent point. So like whenever it is because or we are talking about the bradycardia, it is basically either due to the failure of the generation of the current, which can actually lead to less generation of current which is not getting conducted. Sometimes there may be adequate current generation, but due to some disruption in the circuit itself, there may be some less conduction of the current to the different chambers, resulting into ultimately less heart beating. So this is the problem either in the generation of the current or in the propagation or the current transmission, which can potentially lead to your bradycardia. Now, when it is because of the tachycardia, I mean, we are talking about tachycardia or fast heart beating. So, predominantly, we feel that there are some uh, abnormal situation which can be either from birth itself or can develop as de novo phenomena, like it can either develop as a part of degeneration like aging or due to some evolving condition like ischemia, but mostly in childhood there may be some other substrate like some extra connection in the heart which can lead to some fast heart beating. Sometimes people may be aware of some fancy name like WPW syndrome or something like that. So these are the situation where some extra connection may be there since birth, which can actually get unmasked or can appear at any point of time. Maybe even in the childhood, it is mostly prevalent, but it is not also unusual to see this kind of situation even in middle-aged person. But the substrate was there since childhood. I mean, since birth. And as I said, as you already mentioned about something called atrial fibrillation or ventricular tachycardia. So these are the mostly some situations which can actually develop after some degenerative process occurs in the heart muscle or inside the structure of the valve or kind of muscle itself, like as a part of ischemia or like coronary disease. Sometimes there may be some infection which can also play some role to give rise to this kind of tachyarrhythmia or fast heart beating related problems.
Okay. So, now that we know what is arrhythmia and how it occurs, like in whom it occurs,
Yes.
now let us, can you just enlighten us regarding the symptoms? Like, how do I come to know if I have such a problem, if I am having arrhythmia?
Yes. So by and large, if we want to classify the symptoms or categorize, so the main complaint related to less heartbeat or slow heartbeat often presents to us with blackout or sometimes fatigue, sometimes breathing difficulty, and in unusual context they actually come up with very kind of air hunger or unusual chest pain. So sometimes it may be asymptomatic situation also, but if you ask me a single question or single symptom related to low heartbeat, especially if it is related to extreme bradycardia, which often can be seen in complete heart block situation, means there is some disruption between upper and lower chamber conduction or the electrical current. So this kind of patients or people they, presents mostly with the complete blackout, or we call it medically syncope. Whereas if you talk about the tachyarrhythmia patients, they mostly present with palpitation. Sometimes the long-standing palpitation can lead to breathing difficulty, and last but not the least, sometimes the tachycardia may be even catastrophic, and they don't have that kind of luxury to present with that symptoms. Rather, they appear in a very bad shape with profuse sweating, with very less, blood pressure, and appear in a very stormy phase. So at that time, actually, the patient may not be in proper shape to actually tell their actual symptom to us.
So, in a gist, we came to know what is arrhythmia, um, how a person has arrhythmia, what are the symptoms of arrhythmia. Now, coming to the diagnosis. So, if I am having such symptoms and I come to the doctor, what are the way to understand that this is not a normal blackout and it's an arrhythmia related syncope?
Right. So mostly the history part or the complaint of the patient might actually give you some suspicion to go for detailed evaluation. So it starts from basic ECG evaluation.
Okay.
So ECG is the main cornerstone that I must say. So if you look at the ECG, ECG can give you a lot of information about the basic rhythm, and sometimes we may be deceived because what happens, especially the tachyarrhythmia part, might be little episodic, or you can say paroxysmal in medical language.
Tachyarrhythmia is basically
The fast
higher,
heartbeat
faster
related
heartbeat.
problem.
Yes.
So
Okay.
this may be episodic.
Okay.
So this is the basically problem sometimes to identify this particular event at that frame of time, because when we are going to evaluate a patient, mostly the patient may be in normal rhythm. So, as because I said, it is mostly episodic. So the person may not get the chance to get the episode or the event recorded on ECG. So, in order to overcome that particular problem, sometimes we go for some extended monitoring of ECG, which we call 24 hours holter or 48 hours holter, just to record the event if it happens fortunately. Now, there is also some limitation, as I must say, because if the symptom is not there or if it doesn't appear at that point of time, I mean, when the process is going on, the holter recording. So again, we'll be like in big dilemma. What actually is the problem? So in that case, sometimes there may be some additional evaluatory process which we call EP study, which may look at the thing retrospectively, just to analyze the possibility or to replicate the same situation which might happen if it is related to the true cardiac rhythm related problem. Like if the palpitation part is really due to some cardiac event, it will definitely can be. I mean, sometimes we may be lucky. I must say not sometimes. Maybe in 90% cases, we may be lucky enough to get it picked up if it is really due to cardiac problem. Even if it is due to the bradycardia or the less heartbeat related problem, sometimes there may be very subtle imprint on the ECG, which may not be able to explain the whole situation related to sudden blackout. So in that case also the EP study may throw some light, which actually differentiate whether it is due to cardiac related or maybe due to some extra cardiac cause, which can potentially lead to this kind of symptom.
Okay. So since you have mentioned about TP study
Yes.
as a form of diagnosis of arrhythmia,
Yes.
so I just wanted to know what exactly, like how EP study works, and apart from diagnosis, uh, can EP study, treat arrhythmia as well?
Yes, so basically any diagnostic procedure which can detect or identify the problem uh, is a bliss to us, because you understood the importance of electrophysiology study, because
Yes.
when the other stuffs are not that much useful, so at that point of time EP study is going to have its role, and it can actually unmask the actual problem. So it makes the task very easy for the physician or the cardiologist, to be very honest. And uh, what we call sometimes the EP study may actually suggest some additional procedure which we call radio frequency ablation, which can potentially treat a substantial proportion of tachyarrhythmia or fast rate related problem if it is related to some extra connection, as I said. So there may be some amicable solution available by the same radio frequency ablation, which is importantly can be done at the same city. So at the same time, EP study may sometimes warrant some device implementation. Maybe it is a pacemaker or sometimes some higher end device which we call either implantable cardiac defibrillator or some other way of treating the problem like CRP or CRPD. Those are also important to understand, especially if it is related to cardiac problem, which can be picked up by EP study. So there is definite role of this particular test to go forward and to you know uh, streamline the strategy of the therapy.
So now that we know about EP study, now talking about the radio frequency ablation,
Yes.
the RFA. So is that how effective is RFA, and what are the risk factors involved in it, and how safe is it?
Yes, yes. So, as you might be aware that we call it not actually a surgery, we call it a minimally invasive procedure, and it is very patient friendly because you can potentially distance the patient from the same day of the procedure with making a simple kind of we call puncture or inserting some very thin tubes inside the peripheral vessels like maybe femoral artery or femoral vein, which is very away from the cardiac structure itself. So you can treat the disease without getting any cut marks over your chest or doing any open heart. So you can actually eliminate the disease for the rest of the life. First of all, it is if you actually ask me about the safety, it is actually very safe procedure to go forward, because in an experienced hand, we actually don't see much complication. Yes, complication may be sometimes unavoidable because of the intrinsic hazard or the, I must say, the vulnerability will be always there. But to be very frank, mostly it can be done in a very safe way, and to be very frank, complication rate is very low in an experienced hand, and especially if you have trained staffs along with trained electrophysiology doctor, along with a very dedicated cardiac EP lab. So all these things matter, and nevertheless, you must understand that this is a treatable procedure. I mean, that's a way of treating the disease, the radiofrequency ablation, which is very similar to actually applying some energy like laser or infrared, because it actually generates some heat in a very specified area, in a very precise tissue part. It generates the heat so that it can actually damage the tissue locally without any cut or any major collateral damage. So that is very important to understand. And like after, I must say, from next day onward, you must feel that you actually had no problem anymore.
Problem never
Yes,
existed.
yes, yes.
So, sir, since you have thrown so much of light on this, now coming to the infrastructure, since you said that it is very important to have a proper infrastructure, EP lab. So, coming to the setup that we have here in BM Birla Heart Hospital, I would like you to elaborate on the setup that we have and on the, how we treat complicated cases and what are the dedicated infrastructure.
Yes, so basically, you must understand sometimes in a very, I should say, uh, peripheral hospitals, or the hospitals which has started evolving.
Mhm.
So these things may be little difficult to actually compose or to grow up, because first of all, according to my understanding, what is important to run the show, you must generate some basic premise so that along with the patient safety, the outcome reaches the optimal level. So, as I said, uh, it may look very simple by my previous talk, but actually it requires a lot of expertise along with a very good form of workflow that has to be generated over a period of time. And this is not actually a matter of a day to develop in a particular hospital or in an institution. So basically, it requires lot of gadgets like hardwares. If you are talking about lot of catheters, lot of uh, inventories are required along with the console of EP system. And you must be aware that there are different types of EP system are available. I'm not talking about the vendors, the company concerned. Rather, there are a lot of upgradation, and I should say there are a lot of evolving technology are coming. So it's not possible to mention about everything, but in a very brief word, which I must say, there are a lot of technological advancement which need to be imbibed along with that particular program, so that we can optimize the output. And previously, in our part of this country, maybe it was limited to very small subset of patient or limited candidate who would have been gone for this particular procedure. But as you cherish and as you grow up, so basically you have to understand that the the science has grown so much so that you can actually treat any of the almost any of the arrhythmia, and you can potentially reach different part of the cardiac structures or the cardiac anatomical part to identify the problem and to just kill the bug. It's not bug, but you can potentially treat that particular
Pinpoint
spot.
of the problem.
Yes. So you can pinpoint and you can go or reach to that particular spot, and you can actually treat the disease in a very diligent way.
Thank you for the information, sir. Now, going back to the major problem from where we came to EP study,
Yes.
that is arrhythmia. Uh, eh, what are the risk factors of arrhythmia? I mean, can it cause sudden cardiac death in people?
Yes, so this is very important to understand. We have some common misbelief or misconception in the community I must expect that with the much discussion happening around the world, people are getting a lot of awareness. But still, at some point, I need to re-emphasize the thing that cardiac arrest or sudden cardiac death is very different from heart attack. So basically, when we are talking about sudden cardiac death or cardiac arrest, it is very different from heart attack itself. So, in some of the context, cardiac arrest or sudden cardiac death can happen out of extreme phase of heart attack, but not all the cardiac arrest or sudden cardiac deaths are attributable to heart attack. So, in that case, what is the potential threat or risk for this cardiac arrest is arrhythmia, arrhythmia, and arrhythmia. And we have to understand that this arrhythmia are not benign arrhythmia that we can actually keep it aside or we can go along with. So this is very lethal, and even if it happens for a even single time in your life, it can actually just disrupt everything. Basically, a single lethal arrhythmia can actually be disaster. So basically, when we are talking about sudden cardiac death, that arrhythmia may happen out of sometimes your heart attack itself. But even apart from that heart attack or what we call myocardial infarction or acute coronary syndrome, the sudden cardiac deaths are very common in case of uh, some lethal arrhythmic person. I mean, the person who has the propensity or vulnerability to have that lethal kind of arrhythmia. Mostly that can be because of sometimes some genetic cause or some acquired form like some inflammatory cardiomyopathy. Sometimes it can develop out of some uh, definitely some extreme form of heart attack or lethal form of heart attack, and sometimes it can develop in a very unanticipated way, like apparently normal person doesn't have any comorbidities as such, like your diabetes or hypertension, not even any problems with the lipid abnormality or dyslipidemia. Even in those kind of patients also or person also, that risk will be there unless and until it is evaluated completely. So it is actually not completely eradicable, but eradicable, but at some point you may actually screen out a lot of people to avoid this kind of situations, especially in gym person or sports person where there is excess adrenergic drive or adrenergic discharge, which can potentially put the patient on risk for going for or having some kind of lethal arrhythmia. So this is important, and not only it will happen only in a very known comorbid patient. That is important because it happens even in very young persons sometimes. So hence the importance of the family history or any baseline ECG screening before going for any gym activity or high enduring exercise. So high endurance exercise or high intensity exercises are coming to be discussed. So this is important because uh, you have to understand in a single line that lethal arrhythmia are the most common causes for leading to sudden cardiac death if it is not otherwise.
So, sir, the last question that I have, since he spoke about symptoms, diagnosis, treatment, now the precaution. Is there any way that we can take precautions, from developing arrhythmia?
So basically, this is not a preventable disease per se, mostly because it is not mandatory to have arrhythmia in every patient, but yes, the chance will be there. Basically, some form of arrhythmia will be there which can appear as a form of degeneration or due to some lifestyle problems like some sleep apnea patients or person can actually have this kind of problem, namely atrial fibrillation, some hypertension and diabetes, along with some obesity can also lead to some atrial fibrillation like problems. But if you are talking about the other forms of arrhythmia, mostly it is either the neonatal, I mean, it remains there since, I mean, the substrate remains there since childhood or since birth, or it can develop as the, secondary phenomena of some events like some infection or inflammatory condition, or it can appear as some ischemic events like acute coronary syndrome. So this is not important that you can always prevent that arrhythmia to happen. But once it is identified, yes, looking at the kind of disease, you can actually treat most of the arrhythmia. Not necessarily all the arrhythmia are amicable by radiofrequency ablation. Yes, mostly we can go for the ablation to completely treat that significant portion of anemia, but we have some good medicines or drugs itself which can also take care of the rest of it.
Thank you, sir. Thank you for such an informative session, and I hope our audience have had a clear idea of arrhythmia. In case you have more questions, in case you have certain symptoms that sir just spoke about, and you want to consult us, do reach us at BM Birla Heart Hospital. Sir Dr. Rakesh Sarkar is available here to address to all your problems. Thank you so much.
Thank you.
Thank you.